Bonjour, I'm Dr. Isabelle Amick from On Average MD, and I'm your host. I'm a rheumatologist in the Denver area in Colorado. And if you're looking for a rheumatologist that cares, I am she. Today on the podcast, it is my absolute pleasure to have Lola Ashaye, who is a primary care physician and a lifestyle coach and physician, who is here to tell us about the new system that's called the Direct Care Primary Care System, DPC, Direct Care Practice. And Lola, it's such a pleasure to have you. I'm so excited to have you. Do you want to tell us about your practice and your story? How did you come across the direct primary care? And then we define what direct primary care is so that our listener can understand what this new practice is.
Yes, absolutely. Thank you so much for having me, Isabel. This is such a pleasure to be here. And like I said, I love your passion, and I'm excited that, we're talking about this. But yeah, so a little bit about me. I'm Lola Ashaye, and I have a practice InTouch Primary Care in the Sugar Land, Texas area. And it's a family medicine and lifestyle medicine physician. And I started my practice a few years ago now, and I'd been in the traditional care practice for over 10 years before I started, and I was not, I didn't feel like I was truly meeting the needs of my patients in that system. And it was frustrating oftentimes because as a primary care doctor, a big part of why I went into family medicine was so I could build those relationships with my patients. And the way everything was set up in the traditional care system, there were so many barriers to care, and there were so many ways patients could be very easily cut off from their doctor. Any changes in their insurance plan, any changes in their job, any changes if they lost their job. So when a patient had a life change, their doctor-patient relationship was also threatened. And that seemed like the time where they needed their doctor most. So it just seemed like that setting was not the best way to meet the needs of our patients. And there were many other reasons, which we'll go into over this discussion. But I just felt like there needed to be something different. And so after 10 years in traditional care system, I decided to start looking to see what else I could do. And I came across direct primary care, thankfully. And when I found it, I was so excited. I was like, this is how medicine should be. This is what I signed up for. This is why I went to medical school. It was like, this makes sense, finally. And I was really super excited about it and got into it and learned about it and just jumped right in because I felt like that was truly the way to meet the needs of a patient. And I'm very, very happy I did. I've seen a lot of physicians burn out and leave medicine because of how frustrating the traditional care system is on both the patient and the physician. And I felt like direct primary care was it was a great way to provide care to patients.
Mm-hmm. That's really interesting, Lola, because there's so many points that I want to touch, and we're going to first define what direct primary care is, but I will say this one thing. And coming from France, I've seen the frustration of physicians at a much higher level, more and more with time, where there's more administrative tasks asked of them every single day. And we are being doctors because we love it, right? So it's a passion. And seeing physicians literally not care anymore and just want to stop and not be a doctor and rather be an administrator or just be a researcher or be, anything else than seeing patients, I started also realizing, I was like, wait, hold on, there's something wrong with the system. This is not those doctors. Like, we love our patients. Something is wrong. So it's funny because every time I meet a DPC or a direct care specialist, they all look happy. so I'm like, oh my goodness, this is what we need in healthcare. But tell us a little bit, what is DPC? So what is direct primary care? And this, we can say the same for direct specialty care.
Yes,
Tell us what DPC is.
Sure. So direct primary care is when a patient has direct access to their doctor. And usually that's under a membership model, like a gym membership. So patients subscribe to the practice typically on an annual basis, and that gives them direct access to the doctor via text, email, phone calls, and of course, in-person visits and video visits. And then the other big piece about direct care practices, both primary and specialty care, is that they they don't see as many patients. So their patient panel is reduced compared to a traditional care panel. So in a traditional care practice for primary care, typically they'll see thousands of patients, 3,000 patients in their panel. But in a direct care practice, most will see hundreds, up to maybe 300, sometimes even lower, 200 to like 700 patients, typically the limit. So by seeing a lower number of patients, it also allows them to provide that personal care to the patients that they have and not just kind of rush through. So I think those two components, the easy access and then not over not taking on too many patients, allows direct primary care doctors to provide proper care.
So, there is a lot of patients who are asking, well, what happens about my medication? What happens about my test? Like, so can you talk about that a little bit?
Yes, absolutely. So it depends on what part of the country you are. So the direct care model is available nationwide. And it's not a franchise, but it's a doctor can just, decide to adopt that model in a practice that they open. And so everybody has their own little spin on it, on how they do it, but the basics are similar. In terms of tests, a lot of direct care practices will have access to wholesale testing, especially in terms of labs, because they're able to negotiate directly with the labs instead of having to accept the insurance payments. So when a practice is contracted with insurance, whatever prices have been negotiated with those insurance and the lab need to be respected. But when you are no longer contracted with insurance, like direct primary care practices are, then you're free to do your own negotiations, and then you can get much, much better deals than what the insurance companies can get. And so we're able to pass those savings onto our patients so that the labs are much more affordable. So that's one. The other thing in terms of like medications depends on the states. Some states allow doctors to dispense medications, and so they're able to also patients can get their medications directly from their doctor at much lower costs. In states like Texas, that does not allow that yet. We are able to find many different options for patients. And the truth of the matter is, in a traditional care practice, maybe some of those options are available, but doctors do not have time. The practice doesn't have time to help you navigate that system, find programs that will be affordable. They don't have time for that. So you end up paying a lot more. I mean, and the truth is, we're not even educated on that. Like when I was in the traditional care system, cost was not something that I thought about. I just prescribed the medication and it was up to the patients to figure it out. And of course, some of them wouldn't take it because if they can't afford it, they're not going to take it. But in the direct care practice, we definitely take that into consideration, and we're much more intentional about trying to make sure that whatever we're prescribing is actually something the patient has access to. So it's a huge difference in how the patients are cared for.
It's really interesting. So what you're saying basically is that even though the patient pays a membership fee that allows them to know that they have access to you and that you really truly care for them because you have a much, like maybe 10 times less, right? Or even
Mhm.
more sometimes, much less patients where you're going to provide the best care to them. Even though there's this, they can still save on medication price and on laboratory and labs price.
Right, exactly. So I know
That's
some
interesting.
patients are saying, there is a cost. They have to pay a membership fee, right? But the thing that I think a lot of people probably know by now is even when you have insurance, you pay out of pocket a lot. Like
For
if you
sure.
had to use the system in any way, shape, or form, by now you know that having insurance does not necessarily mean that you're not paying out of pocket. You
Mhm.
pay your co-pays, you pay your deductibles, you pay your co-insurances. There are a lot of out-of-pocket costs. In the direct care model, your out-of-pocket costs are transparent, number one, so you don't get that bill 3 months from now not knowing. And then
Mhm.
number two, you can plan because they're flat, it's a flat membership fee. So
Yes.
you know that every time I don't need to think about when I go to this doctor, I have no idea what it's going to
Yes.
cost. I don't know when that bill is going to come. Instead, you know that I've already paid for the year. I can go in as many times
Yeah.
as I want. So it's the incentives are reversed. We're incentivizing people to come in and make appointments to see their doctor when they need it because now they've paid a flat membership fee instead of the other way around where patients are incentivized not to go to the doctor because they don't know how much they're going to pay and they don't know, when they're going to get that bill. So it's completely like it's opposite and it
Yeah.
makes a difference on how people utilize healthcare.
Yeah, it's funny. It's like the words healthcare versus sick care. That's what I'm
Right.
hearing. You're really going into healthcare and not sick care. In the Chinese, I learned this when I was a kid, but I remember hearing about the Chinese medicine. Like so, in China, a long, long time ago, physicians were paid yearly, and they
Mhm.
would stop being paid the moment the patient was sick. I thought that's
Hmm.
super interesting. We cannot
Wow.
do this, right? Like we're not going to say, "Hey, I'm not paying you anymore." But I like the idea that basically your doctor is here to make sure that you're healthy.
Mhm.
And and I agree. I think that the direct care model seems to be where it's at. I mean, you know my story, and the auditors know my story. I had stage 4 cancer, and literally after a year, thankfully I was in remission at that time, but like literally it was after a year, our institution changed insurance. And
Hmm.
so I couldn't follow my oncologist that I love, that I created a bond with, and suddenly I have to change insurance. I had no way to get to this doctor anymore. I could not. There was no way. And so I'm here and I'm like struggling to find another oncologist. I need treatment every 3 weeks. So I was super scared that I would not get it, that there would be a lapse in the treatment that I was receiving. And, since I'm like, yeah, and this doctor that I found, like, she didn't have the time. So I saw a nurse practitioner, a PA. I kept seeing different people. And at one point, I'm like, I'm done. I'm done. I deserve better. And so that's what I'm doing now. I'm like, no, I deserve better. I deserve like someone that I'm going to follow with and that's going to have my back. And I don't want to change based on my, life changes. Like, I don't want to have to think twice. Oh, do I change this job or do I? No, it's over. Like,
Right.
I want stability when it comes to healthcare. So that really struck a chord for me because I had never seen this. Like, I come from France. France is a single payer system,
Mm.
so there's nothing like this. Some doctors decide to not be in the system to ask for more money than the insurance will reimburse, so you have to pay that difference. But it's super clear, and you don't have to suddenly fear that the doctor is going to leave because they're upset with the system, or that you're going to have to find another doctor because they don't take your insurance. I mean, this is that to me, that was like crazy. I was like, wow, what the, like this, you're already not feeling good. Like, you already have a health issue and then you have to deal with this additionally. So I'm with you. I think that the direct care system, at least for me as a patient, that is the way. So, and I still have my insurance to pay for the medication and to pay for all of this. But I have this continuity of care that is so important to me. Also, I don't want to have someone that's burnt out.
Mhm.
Like, and I'm seeing more and more physician, nurse practitioner, PAs that are being burnt out. And I don't even know, and I don't know what your experience is. Do you think you were burned out before you moved to direct care?
So I think I was getting there.
Mm-hmm.
Um, I think, I've always worked part-time. So one thing that I'm very grateful for was very early on, once I finished my residency, I was so aware of the fact that physicians could burn out. And
Mm-hmm.
so one of the decisions that I made was to work 4 days a week. So I've always worked Monday through Thursday. And I think that really, really helped me. But even with that schedule, I do have 3 kids, and I have a family, my husband. So even with that schedule, it was coming to the point where it was a lot to
Mm-hmm.
handle. And so I think if I had worked a full-time schedule, I would definitely have burned out. But I was getting there where I started to feel like two things. It just felt like there was what a lot of what you said. It's funny you experienced it on the patient side where continuity of care was an issue. I experienced it on the doctor side where I was very frustrated with taking care of a patient, for example, with diabetes. I'd taken care of them for like 3 years or so. And then maybe I just noticed that I haven't seen them in the last like 6 months or so. And that's just because I noticed, right? I don't know how many people I didn't notice because it was busy. And then I'm like, I called them and I'm like, hey, what's going on? I haven't seen you. You didn't do your last labs? What's happening? And all of that. And they're like, oh, I tried to make an appointment with you, but my insurance changed or I lost my job. And so did you find another doctor? No, it's so hard to find a doctor. I really like you. I wish I could come, and all that work. The A1C was 10, you got them down to 7. We're
Yeah.
happy, everything is good. And all that work in 6 months down the drain.
Yeah.
you know? And
Yeah.
it's like, what is the point? Like, why are we doing this? So that was very frustrating for me because I just felt like that a job change should be the last reason that a patient should not be able to see their doctor.
Agree.
Like it makes
Agree.
no sense.
Yeah.
So I
Yeah.
just so that was my frustration is because then it started to feel like why will I work this hard to get a patient to a certain point and then only not knowing when at any point in time everything could change. So that was frustrating for me too.
Mm-hmm. You know what? Where my frustration was recently is that we had so much demand to see new rheumatologists that I couldn't see my follow-ups. And so I'm with you, right? Like you're creating a plan and then you don't see the patient afterwards and someone else is seeing them because we need to see more new patient, more new patient, more new patient. And financially, it makes more sense to have someone else than a rheumatologist seeing those follow-ups. And I got mad. I was like, no, I did rheumatology because I like my patient. I want to see them. And also because if there is something to change, to tweak in a treatment, I need to be there. I have 17 years of studying, this is different. So that it's almost like, yeah, it's like almost like control, like a autonomy that's like removed from you by the insurance or
Hmm.
by the system. And it's not the fault of anyone, it's just the system, right?
Right.
And I just want to share this. Like every time I talk to a direct care physician, there's a big smile. Like people are not complaining. Look at that beautiful smile right there. I mean, it sounds like that's the way that doctors are regaining control of like their love of medicine, so that
Mhm.
the love of medicine is not being what's the word, like suffocated. You're not feeling suffocated. You feel like you have, it's not about the money at that point. It's just about how can you offer the best of you. That's what I'm
Right.
hearing. That's what I'm seeing. Do you agree with that?
Absolutely, absolutely. I think I with the direct care model, I feel like this is exactly what I envisioned when I went into medicine. This is, I can build relationships with my patients. I know them well. They're comfortable. We're not rushed. I can follow up on them. I can be proactive about their care. They're not a number. They're
Yeah.
person in front of me, and I care about them. And so it makes a big difference. Yes.
Yeah. That's beautiful. So there's like still this question of, patients are paying insurance, and then you're asking them to pay on top of that a membership fee. How do you come to grip with this? Like, what's the bottom line? What do we say to our patient to explain how valuable this relationship is?
Yeah, so I think it's important to understand that what we're offering patients is different from what the system can offer. So when patients pay insurance, they're paying into a specific type of system, and there are different types of insurance, right? There is insurance that is supposedly comprehensive, where they pay a high premium and then they don't have to pay as much out of pocket. And then there are some that they pay a lower premium and then they pay more out of pocket. So for people that want, I feel like a great compromise, because cost is an issue, is, find a plan where you can pay a lower premium so that you're covered for emergency room, hospitalizations, surgeries, big things, because insurance is important for big things. But then you can then pair it with a membership where you know that you're covered for the preventative care, which is very, very important. Because the way I explain it to patients is, the traditional care practice with your insurance doesn't give you the same value that direct primary care gives. The value is very different. There's no way you can text your doctor in a traditional care practice, right? So you're paying for that. There's no way you can just call your doctor directly in a traditional care practice. The doctor is not reimbursed for that by your insurance at all. Insurance doesn't pay for you to talk to your doctor over the phone, right? But in direct primary care, that's part of your membership. So also the lab fees are discounted. That's part of your membership. So you're not paying for the same level of care. The care you're paying for is very different. Also, in direct care, if you lost your insurance, you can still see your same doctor. That continuity of care is there. If you needed something after hours and it's something urgent, you're in a direct care practice, you can actually reach your doctor instead of spending that extra money on telemedicine or urgent care of somebody that may not really know you well and make a mistake because they don't really know all of your history. So there's so much, the value is that we're offering is different, and so there needs to be a price for that. And then the other thing about it is, really, when people use insurance for preventative care, it makes insurance more expensive. And so I think that's the thing that people don't understand too. Insurance, at the end of the day, the insurance companies never lose money, right? So by the time, if you're paying for an insurance that covers your physical is not free. They put that cost in there, right?
Yes.
And so you're paying for it, but then now they can justify a higher premium whether you use it or not, because you have because they're saying they're doing all these other things. But if you take those pieces out, you can get a lower premium and then pay for that directly and be sure you can actually reach your doctor when you need it. And that will give you the best of both worlds. So I think it's a great, when people experience it, they understand that it's worth it. Like, it's, once they experience being able to reach their doctor, they don't have to Google questions to their medical and medical questions. They can just text you, hey, what do you think about this vitamin? Should I take it? Oh, no, don't take that,
Yeah.
So it makes a bit, instead of delaying their care and waiting 3 months before they can get in, we can see them same on next business day. There are just so many perks that I think patients really value once they experience it.
It's funny, I'm hearing access to the doc. It's funny, I love to give my emails to the patients. Like, it's very important for me that patients have access to me. It's always been important. I used to give my cell phone even. The problem is that I don't listen to my voicemail, so I was like, don't leave a voicemail. And I got almost like I got in trouble for giving my email by the system, because my nurses were upset. They were like, well, we need to know what's going on. And I was like, well, the patient is trusting me and asking me. And ultimately, at the end of the day, when we go to the portal, it goes to you, then goes to me, and where I'm just cutting this red tape of, having the nurse involved. I mean, sometimes it's like it goes from the portal, goes to someone that's dispatching the task, and then it goes to the nurse. She responds to the patient, then it goes back to the nurse, then it finally later on comes to me, but it's taking a full week sometimes. And you're like, wait, hold on, patient can have access to me. But yeah, they were upset about this. And I was like, well, at the end of the day, like, I'm here for my patients. Even my colleagues were upset because they were like, hey, we cannot provide this level of care. And I was like, why not? Like, those are our patients. They should have access to us. And also what I realized is that someone that doesn't know my patient may recommend something that doesn't work. Maybe they don't know that they are anxious, or maybe they don't know what type of flares they have. So I think that this level of access to us is of utmost importance. And I agree with you. I think it's it's much more valuable than the mentorship that you're requesting, for sure. The other thing that I'm hearing when you're talking is it keeps coming back to the vision that I have of a while back, the type of doctors that we used to have, that were the doctor of the village, that was part of the family, that knew everything that was going on in the families, and could really provide care that went beyond just medication and beyond like, what are you here for? And then you can be like almost artificial intelligence, sorry. And just like be, okay, this is what she needs. Like, okay, this is the lab, or this is the medication I'm giving. And I'm like, hold on. Like, we are human, and the interaction that we have is healing. I mean, clearly healing. There are studies to show this. And when I hear you talk, I see this doctor that is part of the family, really part of the community. Is this how you see yourself?
Yeah, absolutely. I think I know, this is the first time since I've been in traditional care practice that I actually know all my patients. Like, if so if a pharmacy calls, I'm like, oh, we're calling about this patient, but oh no, that's not my patient. Like, I don't need to look at the chart. I don't need, they can, if anybody calls and asks me a question, I can answer it without looking at their chart, because I know them, which was not the case ever. So it makes a big difference. And also, as when you know patients at that level, they're comfortable and they tell you more. And the more they tell you, the better you can take care of them, because, once there's that trust, it makes it a lot easier, because now when you ask them to do something, they do it because they trust you, which is different from when they don't really know you. They're hesitant to take your recommendations. So it makes a difference for sure.
So I'd like to finish with a history of hope. Do you have a history, or maybe mini history, of hope that's related to the fact that you are offering direct primary care?
Yeah. So, the first one I'll talk about is a patient that didn't have any health insurance. And it was a young patient. And he came to the office because they were concerned about high blood pressure. Turned out that his blood pressure was fine, but we decided to do regular labs. And his cholesterol was almost 300, his LDL. It was high. It was over 200, his LDL. And I was like, whoa, like, that was not, obviously he had no symptoms, but he had very high cholesterol and probably familial. So we were able to really talk about lifestyle medicine. So, talked a lot about what kind of changes he could make to his lifestyle to lower his cholesterol. And we put him on a very small dose of a statin. And in 3 months, his cholesterol was under 100 at his LDL. And I was so excited, because it just felt like, first of all, he would never have known, because it was, early 30s. And that's the thing, when people say they're healthy, it's like, how do you know? Did you actually check? So he would never have known. And those are the kinds of people that, they say, oh, he was fine. And then one day he had a heart attack. Like, we need to be being proactive about care. Preventative care is so important. So That really excited me because it just felt like something major. Another example was a patient that had insurance but had a high deductible and hadn't seen a doctor for a while and had this mild symptoms. She wasn't really sure it was anything. She actually thought it was something else, and she kept mentioning that to me. But when I examined her, I was like, not sure that this is what it is. Let's do some imaging and make sure and confirm what this is. And we did imaging, and it turned out she had cancer.
Mm.
So she's gotten treatment for her cancer now, and she's, recovering well and everything. But this symptoms had been going on for months. And because she found out about the direct care practice, the fact that she had a very high deductible, right? So she knew if she had gone into regular practice, she was kind of pushing it away because it was mild. Her symptoms were not that bad.
Wow.
But once she found out that she had this option, she was more ready to come in, more ready to check it out, and we were able to diagnose this and get her treated. It was actually after that case that I got so much more bolder, because before I would talk about, direct care, it's a good option and everything, but but when I saw I have so many stories, but I've seen how it's helped so many people that are delaying their care for whatever reason. It's just like you don't have to delay your care. If you don't have insurance, you don't have to delay your care. If you have a high deductible, even if you have comprehensive insurance and you're having difficulty getting to your doctor, you don't have to delay your care.
Yeah.
Going to a doctor can literally save your life. So it's important to just, don't take it for granted. I always tell, please don't take your health for granted. It's so, so important. It's like a child. If you ignore it long enough, when they grow old, things will be very bad. But if you care for it throughout, it's going to make a big difference. So
Totally.
it makes sense to value your health.
Thank you so much. That was really wonderful to hear this, and so much hope. I have so much hope for the state of medicine now, thanks to direct care. Lola, Dr. Ashaye, sorry, where can we find you?
Yes, you can find me online, www.intouchprimarycare.com. That's INTOUCH, primarycare.com. And I also have a YouTube channel, the InTouch Primary Care YouTube channel, where I share lots of health information, a lot of lifestyle medicine as well. And you can also find me at Instagram or Facebook at InTouch Primary.
Oh, this is wonderful. Well, thank you so much, Dr. Ashaye, to share all of this experience with direct care, primary care. So I'm Dr. Isabella Mig. I'm a rheumatologist in the Denver, Colorado area, and I'm about to open the first direct care rheumatology practice. Yeah, after seeing how amazing direct primary care and direct care specialty can be. And I'm so excited to be part of this movement, because I think we're getting back the care that our patients deserve. So please subscribe, share. This is Unabridged MD, and it's on Twitter, Facebook, TikTok, I think now I started, and on YouTube. And we will see you next week. Thank you so much. Happy holidays. Bye.